Hey guys, so in today's video, we're going to be talking about warts. Hey guys, it's me, Dr. Nooreen, your resident foot and ankle specialist, and welcome back to my channel. Okay you guys, so let's start talking about warts. So what are warts? Okay guys, so we're going to be talking about warts in this video today, and in particular plantar warts, specifically warts on the feet. So warts are also known as viral warts or verruca pedis, and it's a common skin condition that can be seen in children or adults. And they look kind of fleshy and kind of like a growth of skin or like a callus, and they can be painful. So what causes warts? Warts is caused by HPV or the human papilloma virus, which is a DNA virus. And on hands and feet, the HPV virus subtype typically includes strains 1, 2, 4, 27, and 57. And what that virus does is it triggers cell growth, which then causes thickening and hardening of the outer layers of your skin. And in order to be infected with the HPV virus, you need an epidermal abrasion or an opening in your skin mixed with an impaired immune system. Okay, so who gets warts? Who is more susceptible to getting warts? Usually kids and children get warts more oftenly, and that is because their immune system has not built up immunity towards the HPV virus at that young of an age. The second type of person that could get a wart is someone who has a weakened immune system. So anyone whose immune system is compromised so that it cannot effectively fight the virus. And the third type of person that could get warts from the HPV virus is someone who has an abrasion in their epidermis, or again, a cut in their skin, and then who is then physically exposed to that virus. Because that cut in your skin will allow the virus to basically embed itself in your skin. Can warts spread? Yes. Warts can definitely spread. They can spread from your particular body to another part on your body. Like if you scratch or touch a wart on your hand and then you touch your feet, you could potentially be spreading that virus. And the virus can also spread from person to person. Can you do anything to prevent warts? You guys, what you can do is be cautious by making sure that if you do have warts, don't touch them, don't pick at them. If you do touch them or pick at them, immediately wash your hands afterwards. Don't touch anyone else's warts because they can spread to you. And if you're treating your warts at home or your doctor is giving you something to do at home to treat your warts, make sure you wash your hands immediately after doing the treatment. And in particular, you want to keep your feet dry because warts like moist, soft, injured skin. And if you're going to be in a public washroom, a public locker, a public pool, any sort of public space where your feet will be exposed, make sure you're wearing waterproof sandals or something protective on your feet. Okay guys, so how do you treat warts? Now you guys, there are tons of ways out there to treat warts. Because there's so many different treatment methods for a wart, what that tells you is that there is no good one way to treat a wart. So with that being said, keep in mind that if you are someone who has warts, they are very difficult to treat, which is why there's no one good way and there's so many different ways that you could potentially treat them. So if you are someone with warts, just be patient and know that it's going to take time to get rid of those warts. So some of those treatment options are salicylic acid, which is an epidermal keratolytic, basically fancy way of saying that it breaks down your skin cells. The next option is bleomycin, which is a form of immunotherapy. And then there's also cryosurgery or surgical excision, which is the physical destruction of the tissue. And you guys, there's a whole bunch of other treatments out there too, like laser and stuff like that, but I'm just giving you a quick list of some of the treatment options. And the key thing with any of those treatment options is that understanding that the virus lives in the basal cell layer of your epidermis, which is the very bottom layer of your epidermis. So when you're treating warts, you want to debride those top layers of skin because you want to be able to expose the medication that you're applying on the wart to where the virus actually lives. So that's one of the reasons why it's good to see a physician if you have warts, especially if they've been present for more than 6 months, because you need someone to clear up those top layers of skin so that once the medication is applied, it's actually being applied to where the virus is living. And you guys, sometimes you have to use many different treatment options to get a result with treating warts. And like I said before, you guys, just keep in mind it's very difficult to treat warts and just be patient. Alright you guys, so does duct tape really work for treatment? So as far as I know, there's one study that looked at duct tape as a treatment option. It was done in 2002, and they compared duct tape versus cryotherapy. They had patients that aged from ranges 3 to 22 years old, and they either got cryotherapy every 2 to 3 weeks for up to 6 sessions, or they were wrapping duct tape on their warts every 6 days for 2 months. And what they saw was that 85% of the warts treated with duct tape cleared up, and 60% of the warts treated with cryotherapy cleared up. Now, the mechanism of action for duct tape and how it works isn't quite exactly understood, but the theory is that every time you rip off that duct tape, it acts as an irritant to the top layer of your skin and kind of rips off those top layers of your skin between the applications of duct tape. Now, you guys, with that being said, there isn't enough data out there about duct tape to make a recommendation for using duct tape, but if you want to try it, go ahead, try it. Just make sure you don't have an adhesive allergy. You guys, one of the last things I wanted to address in this video about warts is, does the HPV vaccine protect against warts? Now, there are no clinical trials to address the use of the HPV vaccine for verruca or wart. However, there have been some case studies that show warts clearing up after receiving the HPV vaccine. So there has been some anecdotal evidence that the HPV vaccine might be helpful in treating warts, but there isn't enough data out there to make a clear recommendation. Now, you guys, there's so much more detail that I can get into when it comes to warts, about, different treatment options and stuff, that if you have a specific question that you want me to answer about warts, please leave them in the comment section down below and I'll do my best to address them. Or if you have a question about something I said in this video that you would like cleared up, let me know again in the comment section down below. You guys, I hope you found this video helpful and informative, and as always, don't forget to stretch and subscribe, like this video, and I'll see you guys next week. Bye!